Hi, my name is Mia Sofer, and today I will be talking about how sleep deprivation affects your mental and physical health. Imagine trying to function with the mental capacity of someone who is legally drunk. That's exactly what happens when you pull an all-nighter or consistently sleep less than 6 hours a night. According to the CDC, 1 in 3 American adults doesn't get enough sleep. This epidemic is quite undermining our health, safety, and success in ways people never realize. Today, I will explain how lack of sleep affects your brain, body, and reveal what happens during the mysterious hours you spend unconscious each night. Understanding sleep is crucial because it affects every aspect of our life. Poor sleep impairs your ability to learn, increase your risk of serious disease, and can even shorten your lifespan. By learning about sleep's functions, you can make informed decisions to protect your cognitive performance and long-term health. First, we'll explore the stages of sleep, what your brain does during each phase. Second, we'll examine how sleep deprivation damages cognitive functions and memory. Finally, we'll discuss the broader health consequences of chronic sleep loss. Let me start by taking you through what actually happens when you close your eyes each night. Sleep follows complex cycles through multiple stages, each serving critical functions. Sleep occurs in roughly 90-minute cycles throughout the night. Most people complete 4 to 6 complete cycles per night, each cycle progressing through distinct stages with different brainwave patterns. Non-REM sleep consists of 3 progressive deep stages. Stage 1, light sleep, only lasting a few minutes. During this brief transition, your muscles relax and the eye movement slow. You can be easily awakened during these stages. Stage 2 compromises about half of your total sleep time. Your heart rate slows and your body temperature drops as your brain produces sleep spindles and K complexes that help consolidate memories. Stage 3 is deep sleep, also known as slow wave sleep. This stage is crucial for physical restoration and immune functions, and growth hormones is released to impair tissues and build muscle. Then when REM sleep, when most vivid sleep dreams occur, your brain becomes most active as when you're awake. Your eyes move more rapidly beneath closed eyelids while your body remains paralyzed to prevent you from acting out your dreams. REM sleep increases in duration with each cycle throughout the night. So what about those dreams themselves? Dreams serve as important psychological and cognitive purposes. The activation synthesis theory suggests that dreams help process emotions and memories. Research indicates dreams allow us to rehearse threatening scenarios safely, and they may help consolidate learning by replaying and integrating new information. Dreams aren't just random neutral noises. They're your brain's way of making sense of your experiences. Now that you understand what should happen during a healthy sleep cycle, let's examine what goes wrong when you don't get enough. Sleep deprivation severely impairs cognitive functions and memory formation in frightening ways. Lack of sleep during these cycles can prevent long-term memory formation. Stage 2 sleep helps consolidate factual and projectual memories, while REM sleep is particularly more important for emotional memory processing. Even your creativity suffers. Sleep allows your brain to make novel connections between ideas. Research shows people are more likely to solve complex puzzles after sleeping. Many famous innovations reportedly came to people in dreams or upon waking. When you skimp on sleep, you're not just tired, you're literally less intelligent, less creative, and less capable. But the damage doesn't stop at your brain. Chronic sleep deprivation leads to serious long-term health consequences throughout your entire body. Sleep loss weakens your immune system drastically. People who sleep less than 7 hours are 3 times more likely to develop a cold. Vaccines are less effective when you're sleep deprived, and chronic sleep loss increases inflammation throughout your body. Inadequate sleep increases risk of serious disease. Sleep deprivation disrupts hormones that regulate hunger and metabolism, which leads to increased appetite and weight gain, raising your risk of type 2 diabetes. Chronic sleep loss increases loss of cardiovascular disease as blood pressure rises when you don't get enough sleep. People sleeping less than 6 hours have a 48% higher risk of heart disease. Evidence even links to insufficient sleep to increase cancer risk. Your mental health deteriorates with an ongoing sleep deprivation as well. Sleep loss amplifies negative emotion and reduces positive ones. Chronic insomnia significantly increases risk of depression and anxiety disorders. The relationship is bidirectional since mental health problems also disrupt sleep, creating a vicious cycle. Even your physical appearance suffers. Lack of sleep alters skin aging and reduces skin ability to recover from damage. Dark circle, puffy eyes, and pale skin appear after poor sleep. Chronic sleep may accelerate cellular aging throughout the body, making you look and feel older than your years. Today you learned how sleep progresses through distinct stages and serves vital functions to your brain and body. How sleep deprivation impairs your cognitive abilities and memory formation, and how chronic sleep loss contributes to serious disease and mental health problems. You now understand that dreams aren't just random images, but may help you process emotion and consolidate learning.